I'm Dr. Edward Mackay, a vascular surgeon who specializes in venous disease. So we're going to be doing a intravenous laser treatment today on this gentleman who's had failed RF ablations twice. He's on Coumadin, and that may be the main reason. The last time on the RF we double treated, so we're really trying to see if the laser can do what we have failed to do with the RF by increasing the energy. The laser does have the advantage of having more settings and energy settings and ways in which you can manipulate the amount of energy you give to close a vein. Also, this laser is using this technology with a never touch fiber and glass welded distal tip that spreads out the laser fiber to get a more circumferential injury to the vein. So we're hoping this will make the help us get this closed up.
My name is Marie Vasher. I am an interventional radiologist trained here in Tampa at the University of South Florida, and recently joined Dr. Mackay's practice to specialize in vein treatment.
Okay, so we're about to do an endovenous laser ablation therapy on a patient with a stubborn right great saphenous vein that we have had difficulty treating with RF ablation. So first we'll just give some local lidocaine to numb up the initial access site. So leave the wire in, take the needle out. Okay, now we'll give some tumescent anesthesia around the vein.
So she's using the ultrasound to guide the anesthesia so it completely surrounds the vein and collapses it as much as possible, so that the vein was like this before and with the fiber in it. Hopefully afterwards it's going to be tight down around that fiber.
Just take out the inner dilator and the wire and exchange it out for the wire that came in the kit.
So now she's just making sure that the guide wire is where she wants the laser to be. So you put the sheath where you want the tip of the fiber to be, and then you put the fiber in, and then what happens, so the sheath should be right where you want it, and then you unsheath it by pulling this back and screw those in together. See that? So that tells us that we got it in the right position. This is the last double check before you start.
So when you start to see that tip, you got some pullbacks. All right, see it there coming out?
Yep.
Yeah, you're good. Step off the pedal, you're done. Yeah, you're done.
So we just completed intravenous laser therapy of the Great Saphenous. This is third attempt at closure on this gentleman. He's on Coumadin, and that's probably making it more difficult to close. So we've tried the VenaCure laser by Angiodynamics, 1470 nanometer laser. The long wavelength causes less charring of the vein and it's more water absorption, so it's supposed to be less post-operative discomfort. And it also uses this never touch laser fiber that has a glass tip that spreads the beam out and really gets a good circumferential injury to the vein wall. And that's our goal, is to injure the vein wall so it closes down permanently. And we used a little higher energy setting than normal this time because we've had problems, but he tolerated the procedure very well and does not appear to be any flow in the vein now, so that's exactly what we're seeking.
All right, so the procedure went well. We used a high energy to close this gentleman's Great Saphenous Vein due to difficulties in the past with radiofrequency ablation that we've tried a couple of times now. Well, once elsewhere he had it done, and then he came to us. It was still open, so we did the RF again as well as some sclerotherapy, and it remained open. So hopefully with this higher amount of energy with the laser catheter that we just used, hopefully we'll have a good result. We'll follow up with him next week with an ultrasound to make sure. If it's still open, we'll have to put our minds together and go from there and try something else or try this again. So we're expecting a good result though.